Today we're going to discuss a topic that affects many of us, often disrupting our sleep and leaving us in pain: nocturnal leg cramps. If you've ever experienced a sudden painful cramp in your leg in the middle of the night, you're not alone. These involuntary muscle contractions can be quite intense and may last anywhere from a few seconds to several minutes, leaving your muscles feeling sore for hours afterwards. In this video, we'll talk about what nocturnal leg cramps are, the possible causes, how to prevent them, and what you can do to manage them if they happen to you. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. First, let's define what nocturnal leg cramps are. These are sudden involuntary contractions of the muscles in your legs that typically occur at night or during periods of rest. Most often they affect the calf muscles, but they can also involve the feet or thighs. The exact cause of nocturnal leg cramps isn't always clear, but several factors are known to contribute to this painful condition. The causes of nocturnal leg cramps are varied and can differ from person to person. Dehydration is one common factor. When your body doesn't have enough fluids, it can affect the normal function of your muscles, making cramps more likely. This is especially common in warmer climates or during intense exercise when you lose a lot of fluid through sweat. Another potential cause is an imbalance of electrolytes. Electrolytes like potassium, calcium, and magnesium are essential for muscle function. If your levels of these minerals are low, it can cause your muscles to cramp. This can occur due to inadequate dietary intake or excessive loss through sweating, certain medications, or medical conditions. Some other factors that may contribute to nocturnal leg cramps include prolonged periods of sitting or standing, muscle fatigue, and nerve compression. When you sit or stand for a long time without moving, your muscles can become fatigued or compressed, which may lead to cramping. This is particularly common in people who have jobs that require them to be on their feet for extended periods, or those who sit at a desk all day without taking breaks to stretch or move around. In addition to these physical causes, certain medical conditions and medications can also increase the risk of nocturnal leg cramps. Conditions such as diabetes, peripheral artery disease, and spinal stenosis can affect the nerves and muscles, leading to cramping. Similarly, some medications, including diuretics, statins, and beta blockers, can cause electrolyte imbalances or affect muscle function, increasing the likelihood of cramps. When evaluating nocturnal leg cramps, your doctor will typically begin with a thorough medical history and physical examination to understand the frequency, duration, and characteristics of the cramps. They will ask about any associated symptoms such as pain, tingling, or weakness, and inquire about possible triggers like dehydration, physical activity, or sleep positions. The provider may also review your diet, hydration status, and medication use, as certain medications and electrolyte imbalances can contribute to muscle cramping. Additionally, they might assess for underlying medical conditions that could be contributing to the cramps, such as diabetes, peripheral artery disease, or nerve compression disorders. Depending on the findings, further diagnostic tests like blood tests to check for electrolyte levels, kidney function, and thyroid function may be ordered to rule out systemic causes. In some cases, imaging studies or nerve conduction tests may be necessary to identify structural or neurological issues. Now that we understand some of the potential causes and evaluation of nocturnal leg cramps, let's talk about prevention. There are several strategies you can try to reduce your risk of experiencing these painful episodes. One of the most effective ways to prevent leg cramps is to stay hydrated. Drinking plenty of water throughout the day helps maintain proper muscle function and prevents dehydration, a common trigger for cramps. It's also important to ensure you're getting enough electrolytes in your diet. Eating a balanced diet that includes plenty of fruits and vegetables can help maintain healthy levels of potassium, calcium, and magnesium, which are essential for muscle function. Regular exercise is another important factor in preventing nocturnal leg cramps. Gentle stretching exercises, particularly before bed, can help relax your muscles and reduce the risk of cramping. Focus on stretches that target the calf muscles, hamstrings, and quadriceps, as these are the muscles most commonly affected by cramps. Activities like yoga or Pilates can also be beneficial, as they promote flexibility and improve muscle tone, which can help prevent cramps. Additionally, it's important to pay attention to your sleeping position. Some people find that sleeping with a pillow between their knees or with their feet slightly elevated can help reduce the frequency of leg cramps. Wearing loose, comfortable clothing to bed and avoiding tight sheets that can restrict movement may also help prevent cramps by allowing your muscles to relax more fully. Even with the best prevention strategies, nocturnal leg cramps can still occur. If you do experience a cramp, there are several steps you can take to manage the pain and reduce the duration of the cramp. The first thing to do is to gently stretch the affected muscle. For example, if you have a cramp in your calf, try flexing your foot and gently pulling your toes toward your head. This can help relieve the tension in the muscle and alleviate the cramp. Massaging the affected area can also help relax the muscle and reduce pain. Using a warm compress or heating pad can further soothe the muscle and promote relaxation. Over-the-counter pain relievers like acetaminophen or ibuprofen may help with any lingering soreness after the cramp subsides. In some cases, walking around or gently moving the affected leg can help relieve the cramp. This movement helps improve blood flow to the muscle, which can reduce the cramp's intensity and duration. However, be careful not to overexert the muscle, as this can cause additional pain or injury. If you find that you are frequently experiencing nocturnal leg cramps, it may be helpful to keep a journal to track your symptoms. Note when the cramps occur, how long they last, and any activities or factors that may have triggered them. This information can help you identify patterns and potential triggers, allowing you to make changes to your routine or lifestyle to reduce the frequency of cramps. In some cases, if your cramps are severe, frequent, or do not improve with self-care measures, it may be necessary to seek medical advice. Treatment for nocturnal leg cramps focuses on relieving immediate discomfort and preventing future episodes. In some cases, medications may be prescribed if leg cramps are frequent or particularly severe. Muscle relaxants or medications that affect nerve function, such as gabapentin, may be considered. Quinine was historically used for leg cramps, but due to potential serious side effects, it is rarely recommended today, except in specific circumstances. For individuals whose cramps are linked to an underlying medical condition, managing that condition effectively is key into reducing the occurrence of leg cramps. This might include controlling blood sugar levels in diabetes, optimizing circulation in peripheral artery disease, or adjusting medications that might contribute to cramps. Regular follow-ups with your doctor is important to monitor the effectiveness of treatment and make any necessary adjustments. I just want to take a moment to ask that you hit that like button, subscribe to my channel, and leave a comment below to share any tips for others. Anyway, nocturnal leg cramps can be a painful and disruptive experience, but with the right knowledge and strategies, you can take steps to prevent and manage them. By staying hydrated, maintaining a balanced diet, exercising regularly, and paying attention to your sleeping position, you can reduce your risk of experiencing cramps. And if a cramp does occur, gentle stretching, massage, and heat can help relieve the pain and get you back to sleep. If you find that your cramps are frequent or severe, be sure to consult with your doctor to determine the best course of action for your situation. Thank you for watching. I hope you found this video useful. As always, take care of yourself and make the most of your day.